Before starting orthodontics, every patient should ask a few practical questions. First, who is diagnosing and overseeing the treatment? You should always know who your orthodontist is and have a relationship with them. Even if you're doing a few things virtually because it makes it more convenient, before those appliances are placed, you should have a thorough consultation with x-rays and maybe some photos and an intraoral scan. Be careful with plans that treat patients as customers. You need diagnosis. You need a relationship with your provider. You need safety. What is the real cost? You may be looking for something that you think is the cheapest, but do they charge you when you get another set of aligners? Is there going to be a side effect that creates dental work cost at the end of treatment? You want to know where insurance plays into it, and you want to know if you have to pay all up front or if plans are available. Third, how long will this take? We have plans that range from 6 months to 3 years and anything in between. So you need to know what it will take to get your teeth where you want them. The last part matters. Retainers preserve your investment. So you need to make sure that you have a great retention plan and a way to get retainers if you lose or break them. Finally, do you trust your orthodontist? How do they communicate? Can you communicate in your preferred method? Are they going to oversee the plan from start to finish? Are there other orthodontists involved? Having the right fit for your family is so important. Having a healthy smile is a commitment. Start your journey today by booking online through the link below in the comments or on our website.